We are here to sound the alarm on the impact that cuts to Medicaid would have on Virginia, on Virginians, on our communities.
Leading Virginia Democrats at the state capitol and in Washington say the Republican House majority's recent budget resolution, which would cut $880 billion from healthcare and energy over the next 10 years, would be a disaster for low-income Virginians. But not so fast, says Republican Rob Wittman.
It doesn't even mention the word Medicaid. What the budget resolution does do is it sets targets for us to accrue savings to be able to reduce spending. And we have to do that because of a growing budget deficit and growing debt.
The broad resolution envisions a total of $2 trillion in cuts to finance the extension of President Trump's $4.5 trillion in tax cuts.
They claim, if you look at the budget plan, it doesn't say the words Medicaid. But you cannot get to $880 billion. You cannot get to $2 trillion without cutting Medicaid, as the Congressional Budget Office recently said.
When you get down to brass tacks, in the healthcare sector at least, there really are only two areas that it could happen in. Isn't that right? Medicare or Medicaid? What would you see as sort of legitimate cuts in that domain?
Sure. Well, what we're looking to do is to accrue savings. This really is about looking at waste, fraud, and abuse. How do we make sure that these systems are sustainable? And we do that through savings. I think there are a lot of innovative ways that we can do that.
But a state senator points out any reduction in how much the federal government reimburses states for Medicaid will have a devastating impact on about a third of the 1.8 million Virginians who are covered by Medicaid.
This provision stipulates that if federal funding for Medicaid expansion falls below that 90% threshold, the program's expansion will automatically end. As a result, 630,000 Virginians whose lives, as you've already just heard, whose lives have been dramatically improved by the program's expansion, these Virginians will lose coverage immediately.
There's a lot of looks about how we are going to address the number of dollars that come from the federal government and the number of dollars that states put in. I would argue that that's looking at ways to make it more efficient. Virginia's actually done a really good job about making the program more efficient.